Good morning, Karen Lane. I am Mihiraa. Let's start the warm-up session. What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are very essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I like to give to future nurses.
Describe your typical working day.
My day starts with a prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after giving a handover to the next scheduled staff members.
Do you think nurses should attend continuous nursing education?
Yes, I do. The continuous nursing education program helps nurses to update themselves with the current practices in their profession. Moreover, nowadays it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
Tell me a quality that you possess that suits your profession.
I think I have excellent communication skills, which help me to interact with my patients professionally. Apart from this, it also helps me to maintain a good relationship with my colleagues. So I think this is the one quality which suits my profession.
What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
You can now start your OET-speaking role play.
Good morning, I'm Nurse Karen Lane. How can I help you today?
Good morning, nurse. I've been experiencing some blurry vision in my left eye, and it's been bothering me a lot.
I see. Don't worry, we are here to help you. May I know your name, please?
My name is Mihiraa.
Mihiraa, for better understanding, could you please tell me in detail about your symptoms?
Sure, nurse, it started about a week ago, and it's been pretty constant since then. It's not painful, but it's really annoying.
I understand how frustrating that must be for you, Mihiraa. Well, have you tried any medications or treatments to alleviate the blurry vision?
Not really. I've just been hoping it would go away on its own.
Okay. Besides the blurry vision, have you noticed any other symptoms, such as headaches, sensitivity to light, or nausea?
Sometimes I feel a headache. Other than that, no. Just the blurry vision in my left eye. Nothing else seems out of the ordinary.
All right. I'd like to ask you a few more questions to get a better understanding of your overall health. Do you have any family history of eye conditions or migraines?
No, none that I'm aware of. My family has generally been healthy.
That's good to hear. How about your general health? Any other medical conditions or habits I should know about?
Well, I do a lot of intensive exercises, and I'm a heavy smoker too. I've been smoking for about 40 years now.
Thank you for sharing that with me, Mihiraa. From what you've described, it sounds like you might be experiencing ocular migraines. An ocular migraine, also known as a retinal migraine, is a type of migraine that affects your vision. It typically causes temporary visual disturbances, such as blurry vision, blind spots, or seeing flashing lights in one eye. These symptoms can last anywhere from a few minutes to an hour, and are usually followed by a return to normal vision. Unlike regular migraines, ocular migraines do not necessarily include a headache, but they can sometimes occur alongside or be followed by a typical migraine headache. However, to confirm this diagnosis, we'll need to conduct a few tests here at the hospital, including a vision test and some blood work.
Ocular migraines? I've never heard of those. I'm not convinced. It doesn't seem like it should be something like that. Are you sure that's what it is?
I understand your concerns, Mihiraa. It can be unsettling to hear a diagnosis that you're not familiar with. Based on your symptoms, such as the sudden onset of blurry vision in just one eye and the lack of pain, ocular migraines are a strong possibility. Your age and smoking habits are important factors. As we age, our blood vessels can become more sensitive, and smoking can further affect blood flow, increasing the likelihood of these visual disturbances. While I'm not saying this is definitely the case, it matches your symptoms well. To ensure we're on the right track, I recommend we conduct a few tests, including a vision test and some blood work. This will help us confirm the diagnosis and rule out other potential causes. By doing so, we can develop an effective plan to manage your condition. Mihiraa, do you have any other concerns or questions?
I guess that makes sense. If it is ocular migraines, what's the treatment?
Mihiraa, if it turns out to be an ocular migraine, we can manage it effectively with medication to prevent future episodes and alleviate your current symptoms. Additionally, making some lifestyle modifications will be crucial. This includes reducing or ideally quitting smoking, and moderating the intensity of your exercise. Both of these changes can significantly reduce the frequency and severity of the migraines, helping you maintain better overall health.
Quitting smoking is going to be tough, but I suppose it's necessary.
It can be challenging, Mihiraa, but it will greatly improve your overall health and reduce the risk of further complications. We can provide resources and support to help you quit smoking. Now, Mihiraa, can I schedule an appointment for you to have further examinations?
Sure, you may please. Thank you for your help.
You're welcome, Mihiraa.